Hello, my name is Gabriella Ambrosi and I am the President and CEO of Sequoia Senior Solutions. We provide in-home care for the elderly, and many of our clients are affected, unfortunately, by Alzheimer's disease. Last week, we had an opportunity to see how Alzheimer's disease affects the brain. Today, I will be speaking about how to have effective communication with a person affected by Alzheimer's. I will give you some tips on how to prevent and diffuse frustration and how to become a better listener. Your facial expression, your body language, the tone of your voice are extra important when talking and communicating to a loved one with Alzheimer's disease. It is also important to approach her from the front to avoid startling her. If your loved one is sitting, sit down when talking to her. Also, make sure you have some light on your face. It will help the person who has Alzheimer's disease to see the expression on your face and understand what you say and what you mean. Make sure you maintain eye contact as you speak. If there is a chance your loved one will not remember who you are, set your pride aside and say your name before you start the conversation. Do not shout, as shouting makes understanding more difficult. This is true for everybody, but particularly for people with Alzheimer's. Do not get angry. Use simple, direct statements and information. Try to use words your loved one is presently able to understand. Do not give more than one instruction at a time. And do not press for an answer if that worries or confuses your loved one. Ask questions that require a yes or no response if that aids conversation and understanding. When speaking to a loved one who has Alzheimer's, keep the conversation simple. Giving one-step directions such as put the fork on the table rather than can you please set the table can be very helpful when communicating with a person who has Alzheimer's disease. Ask only one question at a time. Identify people and things by name, avoiding pronouns which can be confusing. Be positive. Instead of saying, for example, don't go outside, say, let's sit down and have a cup of tea. Rephrase rather than repeat. If the person with Alzheimer's has difficulty understanding what you're saying, try to find a different way of saying it. If he did not understand the words the first time, it is unlikely he will understand them a second time, even if you say louder. Adapt to your listener's way of communicating. Do not force your loved one to try to understand you. And try to reduce background noise, such as from the TV or the radio when speaking. In addition to making it harder to hear, the TV or radio can compete with you for your loved one's attention. Be patient. Encourage your loved one with Alzheimer's to continue to express her thoughts even if she's having difficulty. Be careful not to interrupt and avoid criticizing, correcting, and arguing.